Hi, it's Mark Leggett. Just to let you know, we'll start the webinar in just a couple of minutes. We'll wait for a few more people to join. Morning, afternoon, evening, everyone, depending on where you are. I'm Mark Leggett, and I'm one of the co-chairs for the RDA COVID-19 working group, and this is our regular webinar series. So I'm going to do a few slides to provide the standard context and give people a sense of where things are, and then we'll continue with updates from the various groups. So the role of the working group, first of all, we're going to talk about our second release. And as I said, we'll have some updates and then give you a sense of what the release is going to look like as we move forward with the project. We get a better sense of what will be needed to achieve our final guideline. So it's an ongoing work in progress. And of course, just to reiterate, the goal of the working group is to define detailed practical guidelines on data sharing in the COVID-19 context and to help stakeholders follow best practices. Whether you're policymakers or researchers, the guidelines are designed to maximize timely data sharing and hence the response in this particular context to COVID. The plan is to have a best practice guideline with sections for each of the subgroups, which we'll hear updates on shortly. The recommendations, as I said, will address researchers and policymakers, as well as many of the stakeholders in the ecosystem. There will also be a catalog of key resources that inform the guidelines or highlight or respond to the guidelines with recommendations, whether it's a data repository or a standard or other appropriate resources in the context. And then finally, the goal after the guideline is released is to develop a decision tree tool, which would help facilitate navigation through the resources and the guidelines. So as I assume many of you know, our second draft was released this past Friday. Continues on with the summary of the efforts to date. And we now have 7 subgroups. The original 7 thematic, as I refer to them, subgroups, which we'll hear from. And then we also have 2 subsections or overarching cross-cutting groups called research software and legal and ethics. So those are our initial 2 cross-cutting themes that have common threads that weave through all 5 of the thematic subgroups. The second release is, of course, published on the RDA website and is available through the RFC process. The request for comments, as you can appreciate at this stage, we're looking for general comments. You know, what's on target with the guidelines, what are gaps, any specific comments related to any of the individual sections. And as we get closer to a single narrative, if you will, or a single voice with recommendations and guidelines across all the themes and cross-cutting sections, we will look for more detailed feedback and input. So at this time, we certainly would appreciate any comments you have about any aspects of the document. The RDA website, in order to provide feedback using the request for comments context, you need to log in, which is available on the top of the RDA website when you go to the any of the pages on the site. Once you log in, then you can go to the COVID-19 landing page and go to the outputs, and the second release can be found there. And you can enter comments. And if you wish, you can also upload an attachment, which might facilitate the comments that you may have on the process. So that request for comments piece is important for us in these early stages, as I said, to try and get a sense of how we're doing and where there may be gaps. So just a couple of minutes on the updated timeline. As you can see, the sprint approach, which we started with a few weeks ago, continues. The third release in the current structure will be this Friday. Once that release is available, and again available to the community for commenting, then we have an editorial team, which I'll introduce in a minute, which will look at a reworking of the document to put it into a common, across all sections, into a common structure and language. And that will result in a fourth release on Friday, May 15th, at which point we will again be looking for additional feedback and comments, and that will be continue to be worked on by the subgroups. So that once we have an additional input from the various subgroups and cross-cutting teams, then we'll see a final release, draft release at the end of May, which will again be available for a longer period for community feedback. And then that feedback will be incorporated into a final release in mid-June, which will go to the various RDA bodies for endorsement, and then a final release at the end of June. So that's the new timeline, which has been reworked slightly to kind of give the various subgroups time to not only curate and work on those resource lists, but also continue to work on a document that would produce a single cohesive narrative. This is the new editorial team, which is being chaired by Natalie Harrower from the Digital Repository of Ireland. And there's a team of colleagues, both from RDA and from the broader community, including a couple of colleagues from PwC who have been involved in the writing of previous RDA outputs. So many thanks to the group, the editorial team, for coming together to work on a single document that will form that final release as we move forward. So we thought we'd take a slightly different approach with the updates. So we're going to hear from our two cross-cutting theme subgroups, with the first one being software. And Michelle, did you want to take it from here?
Yes, thanks, Mark. It's Michelle Barker here. Hi, everyone. This first slide shows some of the basic information about the software subgroup. We were able to set up all of these kinds of resources last week. Thanks to Bridget Walker for responding so quickly in helping us. It certainly helps our collaboration to have these available. I would also like to welcome this week 3 subgroup editors, Sandra Gessing, Leila Garcia, and Wojtek Dabrowski, who will be leading the writing of some sections for us. Next slide, please. Or can I do that? No. This is our current membership. We only opened the email list last week, so it's fantastic to have 32 enthusiastic community members already contributing. Yep, next slide, that's right. Yep, move to the next one. What we've done so far is, in the first release, we had a 2-pager guidelines for researchers. In the second release, we had some guidelines for policymakers, and the Zotero references backing both of those up. Now for report 3, we're aiming to do more detailed guidelines for researchers, and then next week work on the decision tree We're also thinking about if there's any other pieces we want to add, such as some very short recommendations each for publishers and funders. And I know at least one of the other subgroups is considering that. Have our first webinar tomorrow, which is very exciting to get the community together virtually to have a conversation about some of the different points and how we'll move together from here. Next slide. So it's just a quick overview of what our first document said in terms of researcher recommendations. We tried to really focus on things that a researcher could do differently now in this time poor environment quickly. We really focused on quick wins rather than some of the long-term goals. But as we go through the review of some of these in response to feedback, we might look at changes such as emerging R6 and R7 there. And then the next and last slide is a summary of what's in revision to the recommendations for policymakers. So that's our summary. Looking forward to having more to report next week. Thanks, Mike.
Thanks, Michelle. Now I'm going to ask Brian if he would like to step in and speak to the legal and ethical issues subgroup.
Thank you, Mark. My name is Brian Pickering from the University of Southampton. So the legal and ethics cross-cutting group came to the table a week late, of course, but having said that, we hit the ground running, and the team have actually put in an awful lot of effort to produce quite a lot of very useful information. The next slide, please. So as of the 4th of May, we already had 34 members, many of whom are working in across different subgroups at the moment. Next slide, please. And overall, the aim of the group is to pull together a specific guidance and pointers to resources which are available for those working in this area, both policymakers and researchers, but also other stakeholders such as editors and funders. And really we come from the position that during a pandemic, there are a whole new set of challenges which affect the various communities and stakeholders. And so we looked to provide support for all of the efforts going on internationally, and specifically, which was a very important point for us, to avoid the marginalization of those groups who are vulnerable, be that because of where they live or who they are. Our priorities are listed there to provide these cross-cutting guidelines and resources. And then towards the end to produce the decision tree, so to be able to signpost the stakeholders in a customized way, so that they know where to find resources and what to do with them and the questions they should be asking. Next slide, please. So to date, we had our kickoff meeting on the 27th of April, and then at the end of that week we produced our first set of documentation which went into the second release. We meet now every Wednesday at 11 UTC, and on the events page of the subgroup on the RDA website you'll find all of the information there if you wish to come along and join. At the moment, we are pulling together all the resources based on an initial straw man ontology, and are looking to create these decision trees with the idea being that we want to take the stakeholders through an area which they need not necessarily understand, and then refine the recommendations or practical guidance. And the last point there, so our role as well, as far as RDA COVID-19 is concerned, is to provide support to help the different areas and so the different subgroups to navigate the ethical and legal issues. Next slide, please. And so therefore, on the right-hand side of this chart, we're asking all of the subgroups via your moderators and chairs to tell us what the issues are which you find in your group, but also any of the issues that you are aware of in the research community or indeed the policy community that you're involved in. On the left-hand side here, these were the main pointers that we had in the first set of recommendations. So we've put together some cross-cutting principles. So those are the principles like the safe management of data, which are important during these kind of crises, but also the set of obligations. There are both legal and ethical obligations that all researchers and policymakers should be aware of, how to seek some guidance, where to look, and then the initial set of resources. This is now being developed into a more detailed document in parallel to look at how research changes during a pandemic such as COVID-19, why ethics and legal principles are important, and then to make some recommendations, first of all in the short term, but also in moving forward the longer term goals. And I think that's it. Thank you.
Thanks, Brian. Next, I'm going to ask Natalie Myers if she can come in and speak to the Omecs work.
Hi, Mark. This is Natalie. I'd like to give everyone an update on the progress that my co-moderator Rob and I are happy to report for our volunteers. Next slide. We have about 84 members, 41 of those actively co-authoring and contributing in our recommendations. Next slide. And I'm happy to report that within the scope of molecular biology, we have begun to discriminate audiences within our recommendations with a focus on a primary audience of researchers and some secondary recommendations for policymakers and publishers. Our prioritized topics include virus genetics, host genetics and the different types of analysis that correspond with that, structural data, and a new section on lipidomics. Next slide. We are focusing on calling for contributions to help write the Omecs guideline sections. We need new additions, especially for the new subjects like lipidomics. We also are taking suggestions for resources that should become part of our decision trees. We currently have over 60 Omecs entries with curation in progress on all of those. We're holding meetings weekly on Thursdays at 12 UTC with a second touch base meeting for the Pacific time zone. Next slide. And all contributors who would like to participate are welcome. What we're aiming for are very specific recommendations, like you see on the right from the host genomics section example. Our aim is so that COVID-19 research in genomics can be as interoperable and reusable as possible. We're paying particular attention to file formats and metadata that lend themselves to interoperability. Next slide. And we welcome participation from all of you. So I hope we'll see you on Thursday. Thanks a lot.
Thanks, Natalie. Now I'm going to ask Dawei if he'd like to speak to the clinical subgroup.
Hello, everyone. This is Dawei Lin from NIH, US, and I will represent our groups to report what we have done last week. And first, I want to welcome our new moderator, Christian Ullman, and he has a lot of experience with the clinical data sharing, and we're really welcome his expertise in that area. And so next slide. So we have 79 members right now. And next slide. And our subgroup goals are still the same. That generate the sharing guideline and generate a list of clinical resources, and then make a decision tree to help the navigation of the resources. But we do see the new layers of relationship among those goals, and which is show on the graph on the right of the slide. So the guidelines is really that the center of our work, and currently what we have is a list of recommendations, and now we're thinking that how to distill them into some guidelines. And then the resources, we found out there is two types. One is that the members have recommended some resources. I think we're the 70 something right now. All of them are good references, but there were some references that directly cited by the guidelines, and that's the one that I kind of put into the a cylinder down below, and those are the ones that we actually trying to see if make a tag as cited. That means that those references are directly support the guidelines. And I put the different colors there is represent different categories, and like some resources are repositories, some are guidelines, some are publications, and those categories probably are the ones that we're going to do for the decision tree. So that's kind of the relationship we see of all the goals. And next slide. And our scopes are still evolving, and then the ones on the left are the ones in scope. Again, is the ones are out of scope is not that important. It's just that we're not thinking right now is the priority of the subgroup. And then there's some updated information in the recommendations for the first two bullets. And the third bullet is the one that we have some extensive discussions last meeting, and then that discussion result in some recommendation on consent. And for our group, we really need the people who have expertise that mentioned in the bullets that colored black. We especially need people that have expertise in imaging and immunological data sharing experiences. So if you have know somebody, and please ask them to join our group, and we need their help. And then in the out of scope column, and then we have I colored the legal and ethical requirements in red. That's because we recognize there's a new group forming that would focus on those issues. So so in our group, we kind of save the time to discuss other topics. Next slide. So this slide is a snapshot of the recommendations that were put out, and I want to use this as an example to illustrate the new relationship we talk about. So with the help of Yangjun Lee from Johns Hopkins University, and we figure out a way to connect Zotero Library with the Google Doc, and then that superscript that I put a error on is showed that we can cite the particular reference directly into the Google Doc, and then that reference is also listed in the reference down below the slide. And so this is what I meant, that the recommendations directly cite some resources, and all those references are in the Zotero Library, and then we put a cited tag there just to help ourselves. So next slide. And then this is what is look like in the Zotero library. Like say we have resources there marked with the blue color, and that blue color on the right of the column, you can see a tag with the key resources, working group, clinical, and then there's a cited the things that we put it in. And so the things what we're thinking about is that for the additional layer, like say what is the type of the resources, like is it resources or is it protocols? Maybe that the different groups can, or maybe our members can recommend like what the categories they should belong to, and then we can use that tag to organize our resources. So we didn't put it in there because this is a cross group resources. We don't want like do too much of it, and then to see if any interest like to discuss this matter further. Next slide. Yeah, then this is a decision tree that I think we displayed before, and then the top level is like data repository, regulation, guidelines, and scientific publications are the categories we're thinking about to use to organize our resources. Next slide. And this is the roles update of the group. As a Christian joined us as a new co-moderator, and also the Zotero effort now is led by Yunjong Lee. And now we see other people start to comment on the resources and recommendations. I include the Patrick Dunn. Next slide.
Finished.
Yeah, so the upcoming meetings is tomorrow, and we hope many of you can join us. And the documentation that we want to point you to go to is the May 8th clinical 2 page, and that's the documentation will be basis for us to discuss and generate the new recommendations. And I think that is all for me today.
Oh. This is a problem.
I guess these are extra slides here. Let me just, here we go. So Epi, I have Claire.
Yeah, good morning, everybody. Claire Austin here. Next slide, please. Next slide also. So I'm not going to repeat what I've already gone over the last couple of webinars. Just to note that we meet 3 times a week, and we have changed the time on Monday and Friday to give a chance to people in other time zones. So Monday and Friday is now 3 p.m. UTC, and Wednesday remains unchanged at 12:30 UTC. Next slide, please. Next slide.
Is it the progress to date one, Claire?
No, I'm just skipping over that one.
Okay.
So to bring you up to date on the additions to the second and planned third release, we are beginning to specify calls to action to specific groups. An example here is to the Open Government Partnership to add open science as one of its policy areas. So we know that some countries do make open science commitments and they appear in the OGP, but the OGP itself does not have open science as one of its official policy areas. We're also calling for a data-first policy within organizations with respect to research scientists that treats data publication as a first-class research output, equal in value for promotion and things like that, to traditional peer-reviewed articles. We've developed or are developing what we're calling an epidemiological surveillance data model that illustrates the kind of contextual information that is required for EPI, and are also now developing an interoperability and data exchange model, which we are calling EpiTrack, COVID-19 Epidemiological Translational Research Action Center. Next slide, please. Oops, okay. So Gary Mazzaferro has joined our group last week and contributed this model of how do we get from conceptualization to realization, implementation, execution. And so this is really helping our group focus our discussions and the writing of our releases, moving from, intentions and maxims, for example, to a mission and governing ethics. But in the end, what we need is for our users and clients, the people we're talking to, our stakeholders, something that's tangible and concrete that can be implemented and executed. So trying to move from the left-hand side of conceptualization to something more practical on the right-hand side. And we found this very helpful, so I thought I would share with the rest of you if you find it equally useful. Next slide, please. So the next steps for this week for the Zotero web group library, we have 72 people are members. There are 25 people who are actually contributing references and resources to the Zotero library. And by the way, I should say I'm speaking now not for the EPI group. The slide, and I think the next slide applies across all of the subgroups. So I'm speaking to everybody here. 360 references across all subgroups currently in the library. So since there are quite a large number of people contributing, we're now approaching midway in this effort, and it's time to do some house cleaning in all the subgroups. We need to do a really good cleanup of both which references and resources are going to remain in the library and others which need to be tidied up. For example, it's important that every resource have at least an author and a publication year. For filtering, as was just discussed with the clinical group. So tags allow us to filter the resources by category. So we need to come to an agreed upon set of tags across all of the subgroups. And in order to bring some order to the library and some consistency across all the subgroups, so we're forming a small administrator group this week, and we'll proceed to a cleanup. So we're calling for a really big effort this week. Everybody who has contributed, all 25 people who have contributed resources to the library, to go back and make sure that it's tidy, that the essential fields have something in them, like, for example, author and publication year. And we're also going to look at criteria for inclusion. So I've noticed that there are some, I'll give you one example. There's one of the references is a tweet. So what we need is to, and the tweet simply refers to the fact that a government had developed a tracking app. So this is not particularly useful. So what we're calling for is to apply academic standards to which resources you include in the Zotero Library. So peer-reviewed publications, gray literature, absolutely. Gray literature, for example, government websites, repositories, research institution material, things like that. But newspaper articles, tweets, blogs, and so forth, unless there's a very, very, very compelling reason for them to be there, then we're asking you to please go in and remove them. So we'll be working on that this week, and we ask for your cooperation, collaboration to help tidy things up. This week, we're also going to, with that effort, we're making the library open to the public. So this is another motivation for going and cleaning it up. Let's do some good house cleaning before we open the door wide to the public. So acknowledging the effort of the EPI subgroup, and I'll pass it over to the next presenter. Thank you.
Thanks, Claire. And I think Amy is going to do an update for the social science group.
Yeah, thanks, Mark. This is Amy Pienta. I work at ICPSR at the University of Michigan. The co-moderator for this subgroup is Irina Kuchma. And like many of the groups, you can find out more information about the social subgroup from the various parts of the RDA COVID social work group section, with all links provided here on the slide, and easy for you to catch up on what is going on. We have, as of yesterday, 85 members of the social science subgroup, with many of these helpful volunteers very active in producing the recommendations from our group. Next slide. So we had very prolific writings and meetings the first several weeks when we formed. And so we produced both short recommendations for version 1 and more extended guidelines for the social sciences early on. So this week, as we met and discussed where we were at and what we needed to submit for version 2, we reviewed the comments that had come in and did not make any changes to the short recommendations that we had made. But in the longer guidelines for data sharing in the social sciences, we did make some minor edits. As a group, we are meeting on Thursdays, so you can see the list of dates for our upcoming meetings. We meet at 11 UTC and in those meetings, we are discussing the comments that have come in and setting the agenda for the next writing sprint. So highlights from this week. When we met last Thursday in our subgroup meeting, we spent time talking about the use of proprietary formats, or not using proprietary formats, because we had some comments on that in our guidelines. So that moved some of our thinking along in that regard. We discussed also data management plans and how best to support data management plans amongst social science researchers. And we also had a discussion about the value of identifying some disciplinary use cases for the guidelines to both help refine what we are recommending and demonstrate for us how much utility they have for the various disciplines represented by the social sciences. We also had a discussion about how to solicit input from stakeholders on the guidelines. We'd also had that discussion in the sort of discussion across all of the subgroups, the chairs and moderators when we meet on Tuesdays, discuss stakeholder input, and we generated a list of places that we might approach to determine, again, the utility of the guidelines that and recommendations that we are producing. And then we finally wrapped up talking about some of the additional areas that we wanted to develop recommendations in, including selectivity bias and recommendations around vulnerable populations. We also, these last two slides that I'm presenting to you reflect one of the recommendations that we spend more time on in the social sciences, which is to ensure that we are positioned so that social science data can be linked to data from the other domains. So of course, there are social science questions that need data that are important in their own right, but at the same time, we want to make sure that the data that social scientists are collecting or putting together can be used in combination with other domains. And so when we are listening to other domains, ensuring that there are indicators or adequate demographic information is made to make projections and estimates, we also are thinking about what are the key indicators from the social sciences, so social and economic and political statuses, for example, and making sure that the data that we produce are linkable to all the other domains, so that it has utility both for social scientists, but for others as well. So the next slide shows a couple of the recommendations that we have put forth that get us closer to being able to share data across domains. So one is a recommendation that falls under the area of data quality, where we recommend that especially official statistical agencies ensure that there are, at least at a minimum, the kinds of variables are part of data that they are sharing and collecting and making available that will allow linking to different types of data produced around COVID-19. So things like geospatial codes and time stamping. And so making sure that those minimal things are available. And then the second, that for all researchers who are collecting data and where possible, that the best practice we understand is, of course, to store data without direct identifiers. So that's commonplace in the social sciences. But that it's important also to keep a separate file apart from the rest of the data that does provide that linking relationship, so that the things that we can use to link the data to others are not destroyed, but rather available under controlled circumstances to be connected with other data. So we wanted to give you sort of an example of sort of the key recommendations that we have spent time talking about in hopes that it stimulates discussion and thinking. But with that, I welcome you to attend our Thursday meeting and turn it over to Mark.
Thank you very much. And our final subgroup presenter, Timea, is going to give an update on the community group.
Hello, everybody. Just the community participation, just a quick update for the community participation subgroup. Next slide, please. So we currently, as of yesterday, we have 114 members, which is it's a generous participation, and we are very, very grateful for all the contributions that we have received. Next slide, please. Currently, in terms of updates, we are working on 2 documents. So one is the initial the initial recommendation and scoping document, which is available at the link that I've put in there. I've tried to have tiny URL, so then it might be easier to find. And the second document, so this initial set of recommendation, which was included in the overall release that was done on the 24th of April. The second document is focusing on a use case, the app development for community-generated data. And this second document is part of our overall approach, the one that we set out in the scoping document, which is that of framing next versions around use cases. We welcome all contributions to both documents in suggestion mode, and are very grateful for everything that has been done so far. Next slide, please. So I'll just touch upon this later document, so the second document on the use case, which was the focus of the group's work last week. So we had a writing sprint with over 30 participants, which was very, very good. We've developed this working document, which is available at that link, and we welcome further contributions to it. In this document, we have outlined challenges and recommendation, and it is currently structured. It is currently divided in various sections, covering areas or topics like transparency and community participation, data collection and documentation, data storage and long-term preservation, also legal and ethical requirements. And I think the software development is also missing as a key topic there. And for these 2 specifically, we are very much looking forward to working with cross-cutting groups that have been set up. There's also been a very interesting conversation related to whether to encouraging the use of the app, and in this very, very particular and sensitive context. So again, the documents are open for further contributions, questions, suggestions. So please use the suggestion mode to add your comments, and we welcome all contributions. Next slide, please. In parallel, we have been like all the other subgroups working with Zotero and continuously collecting resources that will be further collected and stored in the Zotero library under specific tags that we are working on. Instructions will be shared via have already been shared, but will be recurrently shared with the mailing list and the Slack group, which are the means of communication with the subgroup. Yes, that's the quick update on the community participation subgroup. Thank you.
Thanks, Tamaya. All right, so we have a few more minutes. If you have any questions, feel free to put them in the Q&A. As you can see, our next webinar is scheduled for May 12th. And we will vary the every Tuesday schedule slightly as we move forward with a slightly modified schedule to accommodate the different stages in the writing process, but we will update that shortly. So I have one question here, which is probably directed at Dawei. You mentioned that you need expertise with immunological data. Could you specify this?
Yeah, this is Dawei. Yeah, thanks for the question. And I think what we want the expertise in immunological data sharing is pretty broad, and we want people who are working in the immunological and related domains that they can make recommendations how to share immunological data. And when I say like immunologic data is not the ones that are covered by the Omecs group, like the genomics data, proteomics data, are mostly the data types like flow cytometry, the cytokine characterization that related to the characterization of our immune system response to the virus, and maybe also hopefully that can help develop treatment, diagnostics, and vaccines. So so anybody who has that expertise will be welcome to join our group to make contributions.
All right, thanks, Dawei.
And
And
can I add something? It's Anne speaking.
sure.
There is also all related to immunology, which is abroad. All the tests and serological tests, for example, that's a huge area of development for the moment, and this is also under what we have called the immunology expertise. We don't have any recommendation on that for the moment.
All right, thanks, Anne. And we have a couple of suggestions from Claudia, which we'll take forward maybe to the next webinar. And that would be maybe some way to sum up the key points in evolution from in the suggestion version 1 to 2, but of course that would apply across the board. So that's a good suggestion. Thanks for that, Claudia. And then the additional clarification on that regarding a couple of examples such as curation of resources and connecting data across domains. So we will look to bring that forward in future webinars. Are there any other comments or questions? And I also notice, Hillary, I didn't know if you had anything you wanted to add before we sign off. I like to pick on you towards the end without letting you know.
Thank you. Anything to add? Well, no, except that we obviously are very grateful. I think there's been huge progress in the first release, between the first release, sorry, and the second. And of course, the addition of the 2 extra subgroups have clearly offered, it's very good to have them there as well. So yeah, I can only say a thank you very much, and we will, the editorial board, we're looking towards in the next releases, not the 3rd one, but the one after, to see, you'll see maybe a little different structure to it. And then also the release with the Zotero and the catalogue and the resources, I think we'll start to homogenize a little bit the phenomenal work that is really going on. I've been trying to tweet updates, and it's impossible to do it. So there's just so many, but yeah, a massive effort.
Hillary, that maybe just the final question, kind of following on from your comments. The question is, what is the plan / timeline for disseminating the outputs to the stakeholders? When should we be engaging our networks in universities, research institutes, health services, etc.?
Yeah. So yeah, that's a good question, and we would like to align a little, and there will be information coming out through the webinar, but also to the groups on this around the the 28th of May. I think we're saying 22nd, 28th of May is the release that we are looking at for the one at the end of May, which we would view as the almost final version. So there'll be public comment period for 2 weeks after that, and then some time to integrate any eventual comments. But the 28th of, let me call it the 28th of May, that's the one I feel that most of us should line up, you know, stakeholders and things to have a look at, because it will have the final format and most of the all the overarching contributions streamlined.
Yeah, that's thanks for that, Hillary. And maybe just to finish off on that, the final question was, should we publicize the release timeline? And I think it's certainly public. I think it's appropriate to give your colleagues and stakeholders a heads up that we would be looking towards some detailed feedback with that towards the end of May penultimate release. So that's publicizing the timeline, I think, is useful not only to get people engaged, but hopefully to ramp up resources at some of our stakeholder groups so that they can provide us with feedback and make sure that the guidelines are meeting the needs of the stakeholders. So,
and could I just say on that, there are slight variations. I think the timeline that you should refer to, and we can always send it again to the subgroups and make sure it's published there, is the one in this slide deck right up the top. Yeah, because there's some variations I noticed in the timelines that are circulating. So it's the one in the long table at the beginning.
okay.
Thanks.
All right, thanks, Hilary, and thanks to all of the presenters and of course all the colleagues that are working with our co-moderators and co-chairs to affect this substantial output in this timeline. So I appreciate everybody's input and for logging into the webinar, and look forward to giving you a further update on May 12th. Thanks all.
Thank you.